Okay, so we often look at health challenges globally, right?
Yeah.
But what happens when you really zoom in, like down to a single city?
Yeah, exactly.
Today we're doing just that, a deep dive into Aberdeen, Scotland, and specifically how diabetes blood testing is handled there.
And our source is this really detailed local guide.
Right. And the mission here is to see how that specific local information can, genuinely transform how people manage a universal condition like diabetes.
It's fascinating. What really jumps out from this Aberdeen guide is how something so widespread isn't just managed locally, but it becomes deeply personalized.
Okay.
So the basics first. A diabetes blood test, at its core, it's measuring glucose in your bloodstream.
Mm-hmm.
It's absolutely vital for diagnosis, sure, but also for monitoring both type 1 and type 2. Gives you that snapshot of how the body's dealing with insulin.
And the guide really hammers home that it's not just about diagnosis. Consistent testing is critical for stopping those serious long-term problems.
Mm-hmm.
We're talking heart disease, nerve damage, kidney issues, that kind of thing. Keeping glucose levels steady is the goal.
And these tests show if your treatment plan is actually, working for you.
Right.
Absolutely. And the local approach in Aberdeen seems to emphasize using the whole range of tests available.
So not just one type?
No, not at all. We're looking at everything from, say, the fasting plasma glucose, that's your snapshot after fast or overnight,
okay,
to the A1C test, which gives you that broader, 2 to 3 month average glucose level.
That's the long-term view.
Exactly.
Yeah.
Then you've got the OGTT, the oral glucose tolerance test, which shows how your body actually processes sugar. And of course, the random plasma glucose test for quick checks. Aberdeen seems to really tailor these tools.
And this is where the local angle gets really interesting, using real stories. They mention a Sarah, a 34-year-old teacher with type 1.
Yeah, her story is quite illustrative.
She's testing multiple times every single day, before meals, after meals, before exercise.
Because for her, with type 1, those real-time adjustments to her insulin are just essential for navigating a busy life. It's immediate feedback.
And then there's John, who manages type 2 mainly through diet and exercise.
Right, a different approach. For him, the guide highlights the A1C test as his sort of long-term progress report.
Showing if the lifestyle changes are working.
Precisely. It shows how consistently his choices are affecting his blood sugar over time. These aren't just data points, they show the impact of personalized care within that local system.
So, practically speaking, if you're actually in Aberdeen, how do you get these tests?
Well, the guide says your local GP surgery, that's a general practitioner, is usually your first stop for routine checks.
Okay, GP, makes sense.
And you can often book appointments through the NHS app, the National Health Service app, which is pretty convenient, or sometimes just walk in.
And crucially, they also offer local diabetes education programs, right? Which sounds really valuable.
Hugely valuable. But beyond the GP, there are other options. Private clinics in Aberdeen are mentioned.
What's the advantage there?
Often faster results, maybe more flexible appointment times. Good for people with really packed schedules.
Okay.
And then for the more complex stuff, like advanced assessments or maybe ongoing specialist management, you've got hospital labs and specialized centers. Aberdeen Royal Infirmary is mentioned specifically.
Ah, the ARI.
Yeah, so it's like a multi-layered system designed to be accessible.
Now, how often should someone be testing? Does the guide give specifics?
It does, but emphasizes tailoring it. For type 1 diabetes, it's generally much more frequent, several times daily, typically around meals and activity.
More hands-on.
Definitely. For type 2, it might be, say, once or twice a day, maybe even less often if things are well controlled just with lifestyle changes or certain medications. It depends on the individual plan.
And what makes that frequency change?
Several things, according to the guide. Recent medication changes are a big one.
Okay.
Also, significant shifts in diet, changes in physical activity levels, or even just being ill that can affect your glucose levels, too.
Illness often throws things off.
Exactly. And the guide also points towards newer tech, like continuous glucose monitors, CGMs.
Ah, yes, the CGMs.
They provide that real-time stream of data, which can potentially cut down on the number of fingerstick tests needed and lets you make adjustments much faster.
So, wrapping this up a bit, the big message from Aberdeen seems to be that this regular tailored testing really does lead to better health outcomes for you.
Absolutely. It means catching fluctuations early, which allows for timely treatment adjustments. And that, in turn, significantly lowers the risk of those severe complications, cardiovascular issues, neuropathy.
So, translating this into actionable steps for someone living in Aberdeen, what does Guide suggest?
It boils down to a few key things. First, establish that consistent testing routine that works for you.
Right. Routine is key.
Second, maintain a balanced diet, the usual suspects: whole grains, lean proteins, plenty of fruits and vegetables.
Standard healthy eating advice, but crucial here.
Crucial. Third, get regular physical activity. The target mentioned is around 150 minutes of moderate aerobic exercise per week.
Right.
Fourth, stay informed. Take advantage of those local education sessions we mentioned.
Yeah, the GP ones.
And finally, perhaps most importantly, work closely with your local healthcare providers, your GP, specialist nurses, whoever is on your team, to make sure your care plan is genuinely personalized to you.
It's not just about the tech or the tests, but that whole support system.
Precisely. What's really insightful, I think, is seeing how this universal challenge, diabetes management, becomes so different, so effective when it's deeply embedded in local resources and community support.
Yeah.
The details from Aberdeen really show how access, education, and those individual stories all come together for better health.
It really does highlight how knowing your specific local options, whether it's your neighborhood GP, a private clinic, or a big hospital like Aberdeen Royal Infirmary, can make such a difference in managing a long-term condition effectively.
Which kind of leaves us with a thought, doesn't it? How does understanding a specific local system, like Aberdeen's approach here, maybe change how you think about broader healthcare challenges? And perhaps, how might it encourage you to really dig into the unique resources available right in your own community?